Yeah, it's pretty interesting. I think we're live now, but we'll start our discussion in a couple of minutes. We'll just give everyone a little time to join. But it's pretty interesting as to the way the cases and everything else has changed, and the entire pandemic, the way it's changed everything we do.
True.
It's the normal has changed. I mean, I don't know. Like, I did not anticipate ever that we're going to have so many webinars and Zoom meetings. This is the new normal.
This is the new normal. Looks like it will stay as the new normal for a bit.
Yeah.
Until thing really goes. Yeah.
So it's
Right now, there's a message I got that it's predicted Delhi will have 1 lakh cases by the end of June. So. And this 5-member committee sat together and they just kind of decided on that. So,
what's the doubling time in Delhi? Doubling time?
Right now it's around 17. Now it's of course going up, but it was around 17 days. It's actually come down. But then what is interesting, if you look at it, is from April 26th till now, we've had more than 2.2 lakh cases.
Yeah.
So till April 26th, we were at like 25,000 or so cases. So this doubling time concept is interesting, but I also wonder if one should look at actually how many, days.
Doubling time, I think it's like a play of statistics.
Correct.
Maybe you started doing more tests. There are more centers that are doing. I think that's the main thing there.
Yeah.
Yeah. It actually makes you nervous what's going to happen. But I think let's start off. I think it's 7:02. I think we should start off. What do you think, Sonia?
Yeah, it's 7:02. I think give it a couple of more minutes, maybe.
Okay, sure, yeah. You're right. The doubling time is a play of statistics. I mean, I recently read that statistic where 50,000, the time it takes for 50,000 cases to increase, it's not like 6-7 days.
Yeah, but I think the good news is that there is morbidity involved: physical, social, mental, psychological. Mortality doesn't seem to be very high, so that's the good thing.
Yeah. I think that is what is reassuring. I think that is the biggest reassurance, because the number of people getting sick, and we know for a fact that not everybody's getting tested at this point, and it's difficult and it's kind of impossible also at multiple levels if you think about it. So yeah,
it's the sheer number of people.
Sheer number. India just has too many people. The density, I mean, social distancing. When we go out in the market, there are days when you wonder for 2 minutes, how is it possible to actually practice social distancing? And you kind of just, wear your mask, try your best. But at the same time, there are just too many of us in this country.
Welcome to Mumbai.
Yeah. I think Mumbai is like the New York equivalent of sorts, if you think about it, right? Like the way
worse than that. Our density is much 3 times higher than New York.
It's like 34,000 people per square kilometer, and Dharavi is like 1.85 lakhs or something ridiculous.
It's about 75,000.
Yeah. It's mind-numbing, the number of people, but it is what it is. It is a strength. I always tell people that we're not a country of 1.3 billion people. We're also a country of 1.3 billion minds.
True.
So, are we live?
Yeah, we're live. So let's start off. I think
they can hear us.
Yeah. So hi. Good evening, everyone. Welcome to our special, Facebook Live today. We're very excited to have a very special guest with us, Dr. Pratit Samdani. And before we introduce him and get going, Samir is going to kind of take over and give you the latest on the numbers and what's happening in India right now.
Yeah, thank you, Sonia, and welcome, Dr. Samdani. I'm just going to show you a couple of interesting statistics, and can you guys see my screen?
Yes.
Yeah. Okay. So this is a COVID tracker. On Voice of Health. It's this initiative that Sonia and I started 2-3 years ago, just to try health awareness, and we have this COVID tracker which tracks every day. And if any of you who are joining, if you have any questions, and we'll repeat this again, just put it in the comments section on the live video, and we'll be sure to address them. Where we stand today, so this virus is only 6 months old, right? And in India, we have 2.5 lakh cases, almost 2.5 lakh cases, and worldwide, we have 68 lakh cases. It's actually, and for consistently now, we've been hitting the 9,000 mark for at least 2 to 3 days, 4 days. Before that it was 8.5, 9,000. Now we're at 9,500. I'm pretty sure with the testing increase, we will probably hit 10,000 tomorrow. Where does India stand amongst the world? Now, this is the number of cases since 3 daily deaths were recorded, and this is the deaths per day. And India's graph is going up, and we kind of expected that, I think, with the lockdown opening, with everything happening. And this over here actually shows India as compared to the rest of the world. US is right here on top. We hope we don't reach those numbers. They're reaching the 2 million mark, but that's about 20 lakh cases. And we are somewhere here. So if you see our graph, initially we were flattening, but I think with the lockdown opening and the density of people and all that stuff, it's increased. We're kind of parallel to Brazil over here. Brazil has also actually really shot up over the last few weeks. Russia is there. Spain has kind of flattened. UK has flattened, and now we are here. This is in terms of cases per million. So when you see per million, we don't have that high numbers in terms of per million population. So that is kind of comforting when you compare it to other countries like US, Spain, UK, Qatar. I think this is Qatar. When you compare it with that, our cases per million is not that crazy high. And this is a picture from the Hindustan Times, actually, from within the last week or so. And you can see over here that, that as time has gone forward, the number of cases have increased. And we kind of anticipated, right? I mean, we knew the numbers were going to increase. So the first 50,000 cases took 66 days, and then it took 12 days, the next 8 days, 7 days. And now going forward, I think this time will only reduce. And this is how it is in India, where the cases stand in India. Dr. Samdani practices in Bombay, and that's in Maharashtra, right? So that's 82,000 cases in Maharashtra. And me and Sonia are in Delhi, and that's about 25, 30,000 cases here. That's almost 1.1 lakh cases. That's almost 40% of all cases in India are between the jurisdiction of Bombay and Maharashtra and Delhi. And so that they're the two hotspots right now, Maharashtra and Delhi. And that's where we are seeing a real fire. And I see that in my practice. I see Dr. Sonia see that in her practice, and Dr. Samdani sees that. That's why he's here. And just to put things in perspective, they've got 82,000 cases in Maharashtra, which is the total number of cases there were in China. In the entire country of China had about 80,000 odd cases, 82,000 cases. So Maharashtra has the same number of cases that are there in the entire country of China. That is huge. We are just saying 2.5 lakh cases, but where it started, the virus started in China, and they were able to contain it to 82,000. In India, Maharashtra only has 82,000. Yes, it's the epicenter, but let's see where we go. And this is one more graph over here. This is how, when people went into lockdown and when they unlocked, where the statistics were. And we are over here. You see China, Spain started unlocking when there was a decline. Germany started opening when there was a decline. Same thing in UK and Italy. We are actually opening as we peak. So that makes me a little nervous. And I guess we'll talk about that with Dr. Samdani, who's here with us today. And, I don't know how to, don't know the proper way to address Dr. Samdani. Dr. Samdani, I know him for many, many years. He's among other things, my personal mentor. And he is also a very well-known physician in Bombay. He's treated many luminaries. I like to boast that I know him. He most recently took our Nightingale of India, Lata Mangeshkar, out. She tweeted about him on Twitter. Among COVID patients, he's seen hundreds and thousands of patients. I actually saw an interview of him where Ashok Chauhan, the minister, the Congress minister, he was also Dr. Samdani's patient, was there on ZTV. So it's not any conflict of interest. He didn't tell me, I saw it in the news. Dr. Samdani, welcome.
Thank you, Dr. Samir Gupta and Dr. Sonia Gupta. Thank you for giving me this opportunity, and your graphs were inspiring and yet depressing, but making my eyes even more open now.
Right.
Yeah, I think India, as we know, India has a while to go before this pandemic actually ends over here, and that's the harsh reality. And our first question that actually we wanted to address was, sitting in Delhi and sitting in all, I think I'm sure everybody sitting in different parts of India, we're always hearing about Maharashtra and more so Mumbai. And we hear about a case in Dharavi and we all get scared, and we hear about something else going on. So we're scared for Mumbai, and then the cyclone, then this tropical storm was coming. So what exactly is happening? How is the situation on ground reality, in the ground level? What is exactly happening in Mumbai? And is it really that bad? Or is it kind of like hyped more than what it's really? Is it really, as bad as this?
Thank you for that question. So yes, I call this is a blessing or a curse for every financial capital of the world. May it be New York, may it be London, or may it be Mumbai. That's the price you pay when you're financially stronger than the other parts of the country. And that's what's exactly happened in New York, and that's what's happening in Mumbai. Well, the truth of the matter is that Mumbai is going through, I would say, a medical crisis. The number of cases are large, are huge. Unfortunately, we are getting families also, members of the same family, obviously getting infected. And there are several reasons. There are social reasons. It's such a thickly populated area. Our density is about 75,000 per square meter. Dharavi, as you mentioned, Dr. Sonia, is the largest slum in Asia. And you can only imagine there could be 8 and 10 and 15 people staying in an area of 8 to 10 square feet. That's how small. They use one toilet. Maybe 50 of them use one toilet. So there's an issue of sanitation, medical health, density population. We are facing a crisis here.
So it sounds like the situation is actually on ground reality, what you're seeing in the media, like I'm not there, right? So it is actually lots of patients, hospitals running full, chaos everywhere. Is that how it is?
It is. The hospitals are certainly running full. They're running to over capacities. The healthcare workers, including the sisters, the ward boys, the ancillary staff are, doing their best they can. They are overworking. They're doing double shifts. Beds is a problem. The government of Maharashtra has taken over 80% of the capacity of the beds in the state. That means they will decide now which patient will go now to which hospital. That means they're going to get about, if you say in the private sector, and please remember, India basically is a medical center where 70% of medical aid comes from private sectors, not from government hospitals. And we have about 25,000 odd beds in Maharashtra. 80%, which means 20,000 beds around, have been now controlled by the municipal corporation and the government. It's still difficult to get a bed everywhere. And I don't feel it's only the medical, hazardness or the medical upliftment that we need. It's also the patient psychology. Just because you've diagnosed with COVID doesn't mean you need to enter a hospital. It certainly does not mean. I think we should refrain admitting patients who are stable. The government has done and attempted a great job by opening these COVID healthcare centers all across the city, where they have facilities for relative isolation. They serve you food. They give you oxygen if you require it. They use a lot of artificial intelligence to actually help you diagnose and treat you. And there are doctors available and staff available. So such relatively asymptomatic or milder infections should not be blocking and occupying hospital and ICU beds. They should be going to these so-called health centers or COVID health centers. I think that's a very good thing the government and the municipality has done. But this needs to be spread in terms of awareness for the common citizen. The fear of death is extremely high. And I would feel this is, we've been sitting at home for 3 months, most, not us, but most of the common people. The only thing that they do is read the news or read their WhatsApp. And the only news that you get is about COVID, and COVID. The more you read about COVID, the more fearful, and you feel you're going to get fatal by reading it. So I think it's a big fear. Please do not sit in front of the TV and read about or listen to COVID The reality is that most people are doing well. Most people are doing well, not only in Mumbai, I'm sure in India and likewise everywhere in the world, most patients do well. You have to be careful. That's the only thing, especially for those group who are at high risk. So I would say the risk of the age of more than 60, 65, people with comorbid conditions like uncontrolled diabetes, uncontrolled blood pressure, heart disease, malignancies, people who are on immunosuppressive drugs, or people who have some other defining comorbidities. These are the high-risk groups. So I think be less fearful. We have to live with it and be watchful rather than fearful.
I think that's such an important point. When remember, Samir, when we spoke to one of our cousins who's practicing, and she was actively in New York, also at the ground level, taking care. She exactly had the same opinion, that they were seeing more of these elderly people and these people who had other comorbidities, and that too uncontrolled more so, that were actually getting sicker. So I think that fear right now people have, that diagnosis, that taboo that is coming with it, is something people really, from a mental health perspective, they have to understand that the stress that you're taking is probably more harmful than the COVID itself. And somewhere I think we have to understand that part too. So thank you so much for bringing that up. I think people really have to understand not to be fearful, but at the same time be careful. So it's just that fear and care that I think
it's not just the old people. What I think we end up also, the young people. Like I've talked to so many young people, and there is like, you are humre to kuch nahi hoga yaar, ki farak panda yaar, matlab it's okay, we'll get a mild form, we'll be fine. But the thing is, like you said earlier, that families are getting affected. I know of at least 3-4 families where one person got the infection and all 12 people in the family, all 4 people in the family ended up getting it. And now the question comes up, who's going to care for them? They're all sick. It's difficult to go out, they're getting home delivery of stuff, but that becomes the big challenge. Like, who's going to take care of them? So it's not just, yes, people are going to be fine, but that 2-3 week period also carries this dilemma. So it's important that actually people not underestimate the challenges that come with the disease, because there are a lot of small nuances that people miss or they don't completely appreciate. But that being said, you talked about seeing all these patients and all these things. How are most of these people presenting? I mean, we've all read the literature, shortness of breath, and no smell, and some GI people. Like on ground in Mumbai, how are you seeing these people are presenting? How late are they presenting?
So in my personal experience, most patients, almost 90-95% patients do have fever. Most of them have fever undoubtedly. They come with sore throat, cough. If you ask them, or if they've read about it, they may say they have lost smell, they've got anosmia, parosmia. To a great extent, I think it's subjective, but nevertheless, if you ask them, they said, yes, doc, I have this kind of symptom. A good number of patients come with GI complaints, that means gastrointestinal complaints like diarrhea. A small percentage do come with overt breathlessness, and those are the ones that you need to be careful, especially if they come in early in the disease. So most patients typically are complaining with respiratory complaints and GI complaints rather than other complaints like dermatological or neurological at the moment.
Okay. Yeah, so and that's the thing, when the 2-week period was down and everybody was eating at home, there was this sudden removal of all these typhoid and diarrhea and GI illnesses. They just went away. Everybody was eating healthy food at home, home-cooked food. And now, with the monsoons coming in, with other things coming, with other people, now you're going to eat the safe puri and the bhel puri, and in Delhi, you're going to eat the chola bhatura, which you were not eating during lockdown. And now they're going to have GI illnesses. So it's going to be a tough call to figure out who actually has COVID and who does not have COVID.
Yes. So you're referring to other monsoon-related illnesses. So yes, I agree with you. So dengue, malaria, other viral infections like influenza, gastrointestinal symptoms, salmonella, typhoid, etc., are certainly going to rise in this period. So it's important to differentiate clinically. And for a patient at home, I think if you've got fever and diarrhea, the most common cause is gastroenteritis or a COVID-19 infection. However, if you have fever, chills, rigors, nausea, vomiting, more than respiratory complaints, your diagnosis shifts away from COVID. At this point for the mass, I think it's COVID or non-COVID. And for the most people, it doesn't matter what non-COVID infection it is. They are happy. If they have to get a disease, they're happy to get anything besides COVID. So this is going to interplay. The monsoons are going to interplay between the COVID and the non-COVIDs. And we are going to see a large overlap of patients. Many of them may have combined infections too. So they can have dengue with COVID, malaria, and then accidentally detected COVID. So you need to be more careful. So I think what Dr. Samir has just said, continue eating at home. Do not eat outside. Boil water. Do not have water or chutney or sauces or salads, especially from restaurants. If you have to have them, make sure it's heated well before you eat it. Otherwise, these are reservoirs of bacteria and infections.
On that note, Dr. Samdani, another thing I would love to, know your take on how is this infection spread? Oh my God, there are a number of discussions. Is it airborne? Is it a droplet? Do we get our food from the restaurant from outside? What precautions do we take? And still people are confused because we've had certain people, certain friends and family members or, people that we know of or patients that call us who've been at home, somebody in their 80s, they've been at home, they've not even stepped out. And then, and they are fine. And there are certain people who've not stepped out, eaten at home, and then they're getting this COVID. So what is your take on this? I would love to know, what is your take on this?
Dr. Sonia, that's such a relevant question. And every time I speak about COVID-19, this question comes up. And I think it's extremely important to, quantify this risk. Right. Number one, the young... and it's true that most of the elderly people, the octogenarians or the 60 pluses have not stepped out of the home for the last 3 months. It's the younger people who come out. It's us or our siblings who go out and come out, whether it's for shopping, for work, for grocery. It's the drivers and the chauffeurs. It's the servants. It's the watchmen. It's the liftmen. It's the normal people who come for any other kind of work at home. These are usually the younger lots. And unfortunately, the younger lots seem to be carriers for this infection. So the moment they come into the house and they've had a contact with the elderly patient or the elderly member of the family, they actually spread the virus. When I say they are carriers, means they harbor the virus, but they are infective. They are not infected. They don't have symptoms of it, but they can transmit it. This disease is certainly spread through droplet infection. We all know that. And the disturbing fact is that this has something medically what we call as the RO value. That's the replication rate. The replication rate is much, much higher than the common flu like influenza. It has an RO value of more than 2.5 and 3 compared to 1. That means one infected person has the risk of infecting 2 to 3 to 4 people compared to influenza common flu, which is just 1 to 1.5. The other, and an interesting thing, and I'm going to take this right now, is diagnosis along with the kind of infectivity it can cause. It's been studied in a small subject by the ICMR that it's only about 7% of the people who are infected who've got a very high viral load, and these 7% can actually infect up to 6 to 7 times. So I think when we do testing, it's imperative at some point of time, and no sooner than later, the government enables us or gets us a device that can actually test the viral load along with detecting it. Because these 7%, I would name them as super spreaders. They are the ones who are going to infect people more severely and more badly. The rest, 84%, are actually very, very milder infections. And this can be done technically by something called as the cycle threshold. So if you have the cycle threshold, which is low, that means the viral infection or infectivity rate is high. So I think we should get this, the ICMR and the government should work, and so that we can isolate, quarantine, do contact isolation for these super spreaders. The other part of this question is formite transmission. That means whether you get this infection from touching surfaces, wood, food, etc. Well, technically, yes, but the virus only lasts for a couple of hours or maximum 2 to 3 days, and maximum on steel rather than wood and cardboard. In fact, it says it disappears from cardboard as early as 6 to 8 hours and 2 a day. Food, I know food is, everyone's lingering to eat outside. So if you have to order food and if there's no choice, even if you have to by choice or not by choice order, I would suggest that when the parcel comes in, make sure you have gloves, remove the baggage or the packet the food comes in, empty the food into your clean home vessel. Please reheat the food. And I say this because someone once asked me, Doc, what if someone has sneezed into the food that comes in? I mean, didn't we all think about it for the last so many hundreds of years that we ate, that someone could have sneezed into it? Oh yes, technically if someone sneezed into it 10 minutes ago and delivers to you, there's a technical chance that you can get it. So heat the food, and I think it's extremely safe to eat food from outside once heated. Of course, it carries the risk of the other monsoon-related infections that we just spoke about.
Yeah, this is some very important things that you're talking about. Like about the food and about the testing and all that stuff. It's pretty. We initially had the antibody test, and the antibody test went away, and now we are getting the antibody test back, and then the Delhi government is saying, why are you testing everyone? Test only some people. And then somebody else is saying, test everyone. So, I personally feel that we should be testing, at least identifying people asymptomatic or symptomatic. And I think you were talking about the viral load. With the number of healthcare providers across the world who are getting infected, including India, there was a report that about 450 people, healthcare people, directly or indirectly have gotten from AIMS have gotten infected, and I think that's where the viral load also comes in, right? I mean, if you are caring for a COVID patient and you're getting hit by the virus every day, your body doesn't have time to heal, and then you can get a higher chances of getting sick.
Yes. So there are two parts. One is, of course, the testing. I think let's take an example of South Korea. Let's not get economics here. We had enough time because we went into lockdown first. So we had time for preparedness. We have excellent scientific background. We have good technology. We have intelligent people in our country. South Korea, Taiwan, two great examples. They went ahead and did mass testing. They had booths for testing. They allowed testing voluntarily. And it's difficult to get a testing for a suspected patient here. If you could do mass testing, I'll tell you two common things that could happen. One, the denominator, that means the number of people coming positive will dramatically rise. And the number of people dying will remain the same because these are the relatively asymptomatic people. The fear of death will reduce because the percentage of death will reduce. Number two, if you allow mass testing and you know that suppose someone has come positive in the house, you can self-quarantine or self-isolate at home so that he doesn't spread, especially to that high-risk patient. Healthcare workers, a healthcare worker is up to 33 times at risk of getting COVID. So my salutations to all our healthcare workers all across the globe. And it sounds like a dangerous situation, but I think if you wear your masks properly, if you wear your personal protective equipment correctly, we call this donning. And most importantly, if you doff or remove it correctly, the chance of you getting COVID is much less. However, it still remains up to 33 times than a person who's away from the hospital or treating COVID patients or sitting at home. So, but hats off to the medical healthcare workers that they are just going out and saving lives at this moment for everyone.
I think everybody needs to realize that at this point, a lot of people are, 33% is 33 times is a very, it's a very
huge.
Big, it's a huge difference. In fact, related with testing, there's a question that we have from Mr. Sanjay Pasricha that COVID testing can only be done by when referred to a doctor. So at what point of feeling unwell does an individual go to a doctor? Because most of the people are told that, do not rush to the doctor. So at what point, should one actually go and get tested?
So I think anyone who has fever, which is more than 3 to 4 days, accompanied by breathlessness, severe fatigue, or has an oxygenation dropping, which everyone may keep a pulse oximeter at home. So anyone with an oxygenation of less than 95%, I mean, assuming your baseline is normal, should seek a medical advice and seek a doctor's help and go himself and herself and get tested if suspected clinically by the doctor for COVID-19.
Right.
So, and so after testing and let's talk a little bit about treatment also. There are all these medicines that we're hearing about, remdesivir, tetruzumab, these medicines, we've all read the research, some data benefit, some not data benefit. Then are these medicines available freely in India? Are they expensive? Are they, in your experience, and you've used them, are they the game changer? I mean, what is your experience been with these medicines?
Dr. Samir, at this moment, we have no antiviral available in India, which is allowed to be used freely in India. The two common antivirals that will be available, I don't know when, but should have been available much, much earlier. And I'll tell you the irony of this. It's remdesivir, which is an intravenous antiviral. It's a nucleotide analog. Remdesivir is US FDA approved. It has shortened the time of recovery to 11 or 10 and a half days compared to 14 days. So I would not say it's a game changer, but that's a small subset of group. It also depends the timing of usage, but that is the best that we have. And it has an efficacy of about 28 to 30%. I mean, if one of my patients had bad COVID and I had a choice between using remdesivir and nothing, I mean, even a blind man would say that remdesivir is the way to go. The other drug is favipiravir, which is a capsule. This favipiravir is a drug that was originally, it's been used massively in Japan for common flu. So favipiravir is going to be available. I think the authorities in India want Indian subjects and data, and this is going to be available as an oral form. So that's going to make things easier. When a patient of COVID-19 goes into a severe form, and that's when he releases what is called as cytokines, where he gets very breathless, he has other laboratory parameters, which I'm not going to explain right now. That's the time when you use a certain group of drugs called the interleukin-6 inhibitors, and that's where you use a drug called tocilizumab. This is a drug that decreases that storm or that flare of cytokines in the body, and that's the correct time. Well, as far as the pricing is concerned, I would feel that remdesivir is going to be available at about 8,000 rupees an injection. You would need it 2 for the first day and then 1 every day for 5 to 10 days. And favipiravir is also available as a capsule, which will be much more economical, hopefully, compared to remdesivir. The irony is that India is sending raw material for remdesivir to United States, and we don't have it available here. I mean, I cannot ponder about this thought, and I feel so bad that we don't have this available here. So I think in the next couple of days or a week, we should get remdesivir available. So it's not a game changer, but I think it's a great modality for at least attempting to save patients' lives.
On that note, let's talk about the most controversial drug that's ever been. I think the amount of attention hydroxychloroquine is getting, it's probably not had it in its entire lifetime it's been in the world. And, we have to talk about it. I mean, papers are being withdrawn in the biggest medical journals in the world, and everybody's confused to take or not to take. Healthcare workers are confused, doctors are confused, the world is confused. But at the end of the day, hydroxychloroquine has been around in India for a long time, and it's been used for malaria. So, I mean, are we Indians? Are we better? Do we take it better? Do we, what is your take on hydroxychloroquine?
This is my personal take, and I repeat personal. I have no validations in terms of saying that I have 20,000 patients, etc. Hydroxychloroquine has been an anti-malarial, as Dr. Sonia just said, for a long time. If you just in your mind, let me go a little bit geographically, just in your mind, close your eyes and see the malaria endemic countries. And the malaria endemic countries, if I have to tell you, are India, Southeast Asia, and Africa. And if we see the COVID endemic areas, North America, Europe, Australia, Japan, China, where malaria was less. So somehow the malaria endemic areas have less COVID and less mortality compared to the malaria non-endemic areas. Also, patients who had a BCG vaccine, most Indians have had, somehow seem to get a lesser or a milder variant of COVID-19. Hydroxychloroquine in COVID-19 is used as an immunomodulator. It does not kill the virus. My personal take, and the ICMR is clearly given guidelines that it should be used, is that there is some truth to the fact that it prevents COVID-19. Healthcare workers have been advised to take hydroxychloroquine as prophylaxis. It's extremely well tolerated because you don't have to take it every day. Another quick one for my healthcare workers or for people who are listening here, who have family members who have got autoimmune diseases like rheumatoid arthritis, where you get joint pains, or SLE for the familiar people. These patients have been on hydroxychloroquine for years, and the side effects are minimal. Gastritis, right in the beginning, that means acidity, and that's about it. I have not seen people dying by taking hydroxychloroquine sulfate. Incidentally or accidentally, in my practice and what I speak to my colleagues, patients who've got autoimmune diseases are coming less with COVID-19. So I'm trying to corroborate in my mind without medical evidence, is hydroxychloroquine actually preventing them from getting a more severe infection? In Maharashtra, we had a whole more than 1,000 policemen who were on hydroxychloroquine, and the incidence of COVID-19 was certainly less. So I think hydroxychloroquine should be used as a prophylaxis. Hydroxychloroquine has been advocated by the ICMR along with azithromycin for treatment. So my take of hydroxychloroquine is there to stay until you get further evidence, which may take 6 to 8 months. You said some papers are being withdrawn. You know, that's like whether the COVID-19 was accidentally released in Wuhan, or was it, I think it's the same story, whether hydroxychloroquine was, whatever it is, properly studied or not studied in the West.
Yeah, that's are you taking hydroxychloroquine?
I've been taking hydroxychloroquine for more than 3 months now.
Yeah,
Once a week.
Same thing. Even initially I was debating, but now I'm also kind of tempted to take it because the other day Dr. Guleria was also on television and he was also like, I'm taking hydroxychloroquine. So, but that being said, hydroxychloroquine, remdesivir is one thing. Another treatment which everybody talks about is plasma therapy. Now, there are all these things for plasma therapy, right? You need a patient, you need a donor, you get his antibodies, you do all the testing, think whether you can give these antibodies. Is this freely available? Or is this just like a one-off case or two-off case you're getting? Like I'm talking about freely available.
Let me tell you about a little bit of plasma therapy. The only way a patient gets immunity is by passive immunity or active immunity. Active immunity is when you get a injection or a vaccine which is not available for COVID-19. Passive immunity is when you can use patients' blood, patients who had COVID-19, they have produced adequate antibodies, and then it's injected into a patient who's got severe or acute COVID-19. So plasma at the moment, convalescent plasma as it's called, is not available. It's still under trial, but I think this is like a vaccine which only lasts for a month, and you only give it when you're really sick. So I think it's an armament. It's a weapon in the armamentarium and should be used when adequately required, when correctly required.
But when somebody needs plasma therapy, what's the turnaround time? Like, is it like easy to get, or do you like have to like go find a donor, get the antibodies ready, 48-hour turnaround time? By this time, it's too late.
Oh, Dr. Sami, super question, and let's expand this question and let's throw this to the government. With the rising, your first couple of slides, with the rising number of cases in India, and the number of patients being treated and going home well, I think we'll have enough patients to have adequate antibodies. When this therapy is stamped by the government and recognized and India FDA approved, I think the young, healthy volunteers or patients who've suffered from COVID-19 should come around and donate blood so that we can store this. Once stored, I think we'll have enough and immense of plasma or convalescent plasma for giving these patients.
On the note of antibodies, what is now, the whole antibody testing, there was a lot, it was withdrawn and now it's back. In fact, we even have a question from Poonam Gupta that do you advise that one should go for these antibodies tests? So what is your take on the PCR testing and these antibody testing now, which is again approved? It's coming back. Who should get it? How should we go about it?
So PCR test is the polymerase chain reaction test. It's a very specific test for any disease. And when we speak of COVID-19, it's very specific, but it's only sensitive to about 60 to 70%. So it's not a 100% test. If you have fever on day 1 and 2, if you have a low viral load, if you have a sampling error, you may not get a PCR positive. Antibody testing, there's an interesting article that's come out yesterday from 4 universities. And we've had several antibody testing, as Dr. Sonia says, that have come into our country and have failed. The problem with antibody testing is that the sensitivity is only anywhere from 8% to 68%. So it's not very sensitive across all boards, and this is global data, not India data. So that means if you want to find out if someone has had COVID, the chances 1:10 or 5:10 to find out if you got it or no. So my take is when you get good test kits, this will be used. But if we get a test kit tomorrow and someone wants to do it, I mean, my personal thought on what I read was I would do a test twice and thrice. So I'll do one today, I'll do one 5 days later, I'll do one 10 days later, so that my percentage of negativity drops. Because as I said, it's 50-60%. So if you do 2 or 3 tests, the chance of you getting all 2 and 3 negative or showing no IgG, that's a past infection, drops down.
Yeah, and IgM is basically a recent infection, an active infection. But I think IgM is not approved so far. It's only IgG that has been approved.
That's right. So people want to know whether they've been infected, and that doesn't make you safe. That just makes you less immune to getting it. It doesn't mean if you've had a past infection, you'll never get it. That data is not out as yet.
Yeah, so I think that is important for people to know, because that's another thing everybody keeps on asking, if I get the COVID infection, will I get it again? And every day, multiple times we get these phone calls from, patients all the time that what will happen. So yeah, I think this is an important point, that just because your IgG test is positive does not mean that, you will not get it, because we do not have the data for it. We'll know it. And again, it's already been 6 months since COVID is out. Maybe in the next few months, we'll get to know, what exactly will be best for that.
Basically, it's also very important that even if you got infected, please continue wearing the mask when you go out. Don't think I'm a share one guy, I don't need to wear the mask anymore. Please continue to wear the mask because you may get infected because this virus may mutate. But one more thing which is we are seeing, we heard about is that, when you look at the data from New York, the mortality on, especially if you look at the New York, the Northwell hospital data, 88% of people who were intubated are dying. The mortality is extremely high in intubated patients. So everybody is now saying just use oxygen, but then when there's a certain level after which oxygen doesn't work. At Chicago, they were trying to develop these masks these gears you could wear on your head as for to give you pressure, but so you could avoid intubation. Like in your practice over here in India, in Bombay, in the epicenter of India, how many patients are actually requiring intubation? Are you is there a point of no return? You're like, what, now I need to really intubate you?
Yeah. So I think we started late, so we have a lot of points to learn. And the biggest point has come from Italy, Lombardy, where they actually did postmortem on patients who had COVID-19, and they found that most people who died were on ventilators. That does not mean, and I reiterate, that does not mean that if your patient requires ventilator, you do not ventilate him. And if he goes on the ventilator, he doesn't come back. That does not mean that. But we have learned from the studies from Lombardy that avoid ventilation as far as possible. So we use nasal cannula oxygen, we use a rebreathing mask, and the best to use when you require high volumes of oxygenation is to use what is called as a high flow oxygen. So high flow is something that we've been using constantly. We've delayed, averted intubations much more than we would have if we had not learned from these studies from the West. Also, let me tell you that patients who've gone on the ventilator, it's not that we've lost all of them. A decent percentage of them have actually come out of the ventilator. So it's the timing of intubation, optimization of therapy, and correct management, which is also important.
Yeah, that's very important. Like if you need the ventilator, you need the ventilator. Let's not, let's not try and, avoid it. If you need it, you need it. There's nothing you can do about it. I think that's an important point that we should understand.
And I think on that note, like, what's your take on these portable oxygen machines and home ventilators, and a lot of questions, again, I'm sure you're getting the same questions from your patients too. Should we buy this home portable oxygen machine? Should we, how do we get home ventilators? When we first heard this question, Samir, and we were like, oh God, like people are going to that extent of actually wanting home ventilators. But I think, is it really that necessary? Because as you said, that percentage of people who actually need intubation is so low. So why, and I think we as healthcare providers, we have to make people understand that you have to get over that fear. As you said, that fear is really, you have to get over that fear.
So it's not a bad idea to keep a portable oxygen machine or a concentrator with a group of people or in a society. But in Mumbai, we have now these, as I repeat, we have these COVID centers which are equipped with this. So if you just need 1 liter or 2 liters or 4 liters of oxygen, you needn't rush to a hospital, you can go there. In terms of the ventilator, my first call was 3 months ago when the lockdown was announced. And one of my patients said, doc, I have place, I can buy ventilators, tell me which ventilator to buy. And my simple question was, I'm giving you a license to drive a truck. Can you drive a truck? Buying a ventilator is not saving a life. Using it correctly. So will you have a doctor, a sister, a nurse who will help you manage it? And the answer is no. It's impossible to have someone with you 24 hours. So keeping a ventilator is more for mental and psychological support and benefit. Realistically, I don't think it's going to be of much use. Needless to say, we have several patients on the ventilator at home, but for other diseases who've been in hospital for weeks and months and gone home on the ventilator because they require home ventilation. So the nurses have been trained. Here, this is a different ball game. So buying a ventilator, to my mind, at this stage is nothing. Money cannot buy you health. It can buy you equipments. It can buy you a good bed. It cannot buy you sleep. It can buy you a car. It cannot let you drive. So it's not required.
When this lockdown started, even I got a couple of phone calls that, should I buy a ventilator? Should I do this? And I'm like, nobody's ever asked me this question. It's pretty interesting. But then when you work out the logistics, now you need a NG tube. You need somebody to do suctioning of the ventilator. You need a catheter. Like, how are you going to manage all that stuff? So it's actually a mammoth task to even think of doing that. But, with the case numbers increase, with the cases increasing, with the lockdown opening, and you saw all those graphs. As a doctor, as a husband, as a son, as a brother, as just an Indian citizen, it makes me very nervous that we are opening. It kind of, because it makes you very nervous. You look at these numbers, you're like, I'm not sure, and tomorrow, I heard that tomorrow in Mumbai, they're going to start the best buses. So
restaurants are opening up.
Restaurants are opening up, malls are opening up. People are asking, one of the questions that came over here from Vikas Goyal was, can I go to the mandir? It makes you very nervous. Does it make you nervous too? What are your thoughts?
Yes, we are in unlock 1. Tomorrow is going to be unlock 1 in Mumbai and certain parts of Maharashtra. The government has given us a guideline on how to do the unlocking. There are several hurdles we are going to face. One is venting out of frustration of people sitting at home. Say they're going to go to venture out, and even if it means nothing, they're going to be on the roads. That's highly unsafe. I think you need to go to off. This unlock 1 is for office, is not for loitering around. If you have parks, Mumbai, we spoke about the density of population. You cannot have 50 people walking in 200 square meters. That's not going to happen. This is a large populous city. So this is scary. Please use your masks if you have to go out. Make sure you sanitize your hands, you clean them properly. If you have to cough or sneeze, do not say, excuse me, please, say elbow, please. So please sneeze in your elbow or cough in your elbow. Maintain a physical distancing. I would use the word physical and not social, because this has already impacted our mental health. So please maintain a physical distancing. Opening up does not mean the end of COVID. It just means that you have to start getting to work. And I think we have to start getting to work, because if you, especially if I look at the healthcare system, any hospital whose EBITDA, that means the earnings before interest, taxes, depreciation, and amortization, drops to below 20%, is not viable. So likewise, all businesses whose EBITDA has dropped are not viable. It's now the question of lives or livelihood. We can save lives to a great extent by following the norms and maintaining a physical distancing. If you're unwell, do not go to office, do not step out of your house, stay at home and keep yourself away from other people. When you're going to offices, I'm sorry, I'm just jumping your next question if I can read both your minds correctly. If you have to go to your office, make sure you maintain a physical distance. Use your own chair, use your own table. At this point of time, do not share foods from other people, because you don't know who's well, who's unwell. You don't know who's a carrier, and you don't know what kind of a viral infection or load that the other person may be carrying. So you have to be careful. When you come back home, make sure you sanitize whatever you have. It's a great idea to go take a shower and a bath. Hot water or cold water does not kill the virus, but soap and water certainly will deactivate or inactivate the virus. So I have people asking me, hot water is good, it'll kill the virus. No, it's the soap that kills the virus. So I think these are important things. It's scary. As far as the question of your mandir or temple, I tell everyone, temple, masjid, church, synagogues is in your heart. You don't have to go to a place to worship. You have to go to your heart to worship. The last that should be opened are places of worship and public places, because there are people who actually sit there for long hours. So I am not for opening up of such places right now. I do realize and understand that we are facing an economic slump, so offices have to open. Well be it. Unfortunately, if you see the slide that Dr. Samir showed us, we are the only country who's opening up before the peak has set in. That should be some food for thought in terms of trouble. So I think we have to be very, very careful.
Absolutely. And I think I wanted to, that is something we all have to understand, and, everyone needs to take those precautions. These are very, very, very important steps that, we all stress upon. And the reason we keep on repeating it is because somewhere we hope that it gets into the heads of everyone that please, 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 this is not a fun disease. It's not something that anybody would want, because not only for your sake, but as Samir always says, it's not just you, it's about everybody else. It's about your family and it's about everybody else. I just want to, clear one question that we have. Anita Goyal has a question, because I think this is important to address, so there's no confusion, that can hydroxychloroquine be used for prevention in their house help? And I think that is such an important question, because a lot of people have house help, and now the question comes, who is the one who's supposed to take it and who's not? So I just wanted, we can just clarify that, so there's no...
Hydroxychloroquine by the ICMR guidelines is for people, for prevention, for healthcare workers, and prevention for citizens who have come in contact with COVID positive patients. That means just because you have a house help, he gets hydroxychloroquine is not at the moment recommended. But do make sure, Mrs. Goyal, that your house help does not loiter around, does not wander around, does not mix around with other domestics and members of the family, of the society and the surroundings. That will decrease the chance of COVID-19.
No, I'll just take another question over here, Sonia. Rachna Singh Mohata has asked a question. If the fever subsides after 3 days, then for how long should we keep a patient in quarantine if no symptoms of COVID? This is also something, with the government of both of Delhi and Maharashtra more emphasizing home quarantine. The question comes up, how long should home quarantine be?
So there's enough data to say, and this is good news, that replication actually stops after 10 days from the time of your first symptom. So in your case, Mr. Rachna, if you had fever for 3 days and the patient is afebrile, he should be still quarantined for at least a total of 10 to 14 days. There is no need to do a repeat test. There are several patients who have repeat positive tests up to 44 days also. So there's no indication to repeat a test. At day 10 to 14, you are in all probability non-infective. So you're not going to infect the other people.
That's good. That's important to know. When the infectivity period ends. We also have. We talked earlier about people getting infections and people going out and the younger people trying to justify it that oh, we are fine, hame kuch nahi hoga, dekh lenge, and then they end up infecting the entire families. But what is, Ashish Singla has asked this question, that what about younger people? What's their risk? And, I read the mortality data 2 weeks ago, which was published. I think they published the first 4,000 deaths. Now we're at 6,500 deaths. And 50% of the people were more than 65 years of age. But that means 50% were less than 60 years of age also. Right, so 50% more than 60, 50% less than 60. We're a young nation. I mean, what are your thoughts?
You said it. This is a play of statistics. We are a nation where 60 to 70% of our population is young. So if you say 50% were young, that's true. But the number of young people, the denominator is very, very, very large. So if 7,000 people have died, 3,500 were young, that means below 60. The percentage of young people dying is much less. However, I must tell you that there are young people who come in very, very, very sick. And these are probably those 7 to 8% super spreaders. It's not a disease that only attacks the elderly. It's a disease that attacks the elderly more commonly, but does not spare the young. So even the young ones are at risk. You also have to be watchful and careful.
And even children, I think there've been quite a few cases in other countries where young children have also gotten sick, where they've not even realized they've had the infection. And then later on, they've had these, episodes of thrombosis and all these like hypercoagulation, where the blood is thickening, just for in simple terms for people over here, kind of disorders. I think the message over here is everybody, whether you're 5 years old or whether you're 50 or whether you're 80 or 25, it doesn't matter. Everybody needs to take those precautions, as Dr. Samdani, mentioned, and you have to take those precautions. Physical distancing, I agree. I think that's a better word than social distancing. People are depressed enough already. And wearing masks, washing your hands, as much as we can follow that will be really, really important.
So, I know you touched upon this a little bit earlier, but, when we talk about the home quarantine, the government is now saying, hospital beds are filling up. We've got a bunch of asymptomatic people who don't have symptoms or mild symptoms who can be managed at home or at COVID centers in Maharashtra, like you mentioned. I think Delhi is also coming up with a similar concept. What are the instructions you typically tell people, or what should people follow at home? What's the alarm bell? Because one of the, we talked about the bed crisis, but one of the things that, just like you have, I got maybe 20 calls in the last 2 days, and I'm not even a physician. I'm not even a general physician treating COVID people. That what if I have COVID? Or where should I go? Or if I get COVID, main kahan jaun? Main kaise karu? So we are getting these calls, and you tell them home quarantine, and then the next question that comes up, there is this point where you get really sick. At that point, if I go to the hospital, what is that point? And if I go to the hospital, will I be able to get a bed in that small period when I get really sick, or my friend or family gets really sick?
Oh. So home quarantine means you have to isolate and quarantine yourself from other family members in a separate room. It's most useful for people who have a separate bathroom and a separate room for themselves. If you have people sharing the same bathroom, or there are many people living in the same house and your house is too small, it's not a viable option. That means you cannot step out of that room until the given time or period. Food can be served to you. It should not be fed to you. The plate or the tiffin can be put in your room. You must give it back. The same person should take it back. You should not have you should not have a direct contact with anyone, not as far as possible, but just with anyone, at least for 10 to 14 days as we discussed. What are the warning signs for a patient who is home quarantined? Unrelenting fever, breathlessness, and oxygen saturation that's dropping and is below 94, 93, 95, and someone whose blood pressure drops. These are certain warning signs. So I think you don't wait until you drop your oxygen level to 80, 85. You start acting as it goes down from 98 to say 93. That's a good enough warning sign that you may require hospitalization. So you have to act fast rather than wait and act.
I think that is important. I'll just take a couple of, I think, maybe one or two more questions that people have asked, and then we'll have one final question which we really want to know from you, since you're actively treating COVID patients. But of course, some people have asked questions of, how can an asymptomatic patient pass on infection? Aditi has asked that, and I think that was already answered, right? That it's through droplet. It's basically through fomite spread. Aditi, that's how COVID infection is, spread on. So that's why people have to be careful. That's why the importance of masks, physical distancing. Again, we're stressing on the same thing, and washing hands, because nobody knows at this point who is carrying the virus and who is not carrying the virus. And that is the reality of it at this point. And I think we all have to somewhere understand that. But Dr. Samdani, now Samdani, you're actively treating these patients. What is your PPE experience? It's all about the PPEs. India has suddenly manufactured PPEs left, right, and central. Everybody's wearing it. We know how miserable healthcare workers are. People don't realize how miserable healthcare workers are in these huge PPEs, and especially in this heat, especially in the humidity. What has your experience been? I mean, do you wear double mask? Like, how are you managing it?
Oh, I'm the wrong person to tell you what I do, but I would tell you what ideally one should do. That only means I'm a little more protective than normal people should be. Well, a PPE is personal protective equipment. It's a material. It's made of a specific material with a specific quality. It prevents percolation of fluids. That's the job of a PPE. It consists of a jumpsuit, or it consists of footwear, leggings, and a top and a hood, or a face or a mask, or a hood that covers you until your chest. It is extremely claustrophobic every day, and I have to sometimes change my PPE thrice a day because I visit 3 hospitals. I mean, you are fatigued at the end of wearing a PPE. You are drenched. You retain carbon dioxide, because if you have to take a round that lasts for 1.5 hours in every hospital, you often retain a lot of carbon dioxide. The only thing you want to come out is just open your PPE and get into fresh air. But as I had said before 40 minutes ago, there's a method to don. That means wear your PPE and doff. If it's done incorrectly, you are at a very high risk of getting COVID-19. But I feel healthcare workers, the moment they've started wearing PPE, the incidence of COVID-19 has dramatically dropped. I could correlate to several of my doctors who work for 8 hours and 12 hours continuously. I am cribbing about working for 1.5 hours and then going out to another hospital. So I get half an hour before I don and doff between 2 of them. Someone who's there for 8 to 12 hours, it's dehydrating. There's a lot of insensible loss. You cannot drink water. You cannot eat anything. You're famished. And of course, you cannot talk too much because, it's not audible. So many of these people, I think, in utter frustration or dying for thirst, they immediately open their PPE. Please sanitize your hands properly. Open the PPE the way it's supposed to be opened. Clean your hands and then go and grab some water. I think when they take these small breaks, that's the time when there is a risk that they do it in a hurried manner, because they are there to save patients' lives. They want to get back to the ICU or the wards because they want their patients to be attended, although someone is attending them. But that's the time you have that 10-minute break, whether it's a loo break or a water break. So that's really, really important.
Please, and I think please everyone just realize how difficult it is. I know suddenly, especially in Delhi, the government is again after healthcare workers and hospitals for XYZ reasons. But please understand, it is not easy for the people, whether anybody, doctors, nurses, the ward boys, the housekeeping staff, the sanitation workers, everybody and anybody who's working in the hospital at this point, actively treating COVID positive patients in isolation wards, wearing these PPEs. It's not easy. So, have that sympathy, continue to have that sympathy. Sometimes some things are overhyped in the media, but it's just a request. It's not easy at this point. So definitely. On that note, Dr. Samdani, I think one last question. Sabi, do you want to ask him?
Dr. Sonia, I just want to tell you.
Yeah.
I mean, I understand that families are not allowed to come to hospitals, but I also want to ask them heart to heart, do they have the guts to come to the hospital? We have patients who do not come to the hospital for non-COVID illnesses because of fearful of contracting COVID. We are going and treating these COVID patients. If we are treating your father, mother, brother, sibling, please understand what we are doing for you. Understand that healthcare worker, the sister, the nurse, who's 500 miles away from his or her home, that poor man who cleans the excreta, the man who serves you food, imagine what they go through.
Exactly. I think people need to understand that. And somewhere, I guess, again, it's lost in translation. I feel we started out, but remember everyone, when you clapped for everyone, when you clapped for the healthcare workers, that time COVID cases we hardly had cases in India. And now we're in the middle of it. And now people are suddenly starting to abuse doctors again. We're getting these WhatsApps all the time. I think, please, do not understand what the healthcare workers are doing. And definitely,
we have families.
I think that support is important. I think if we continue to have that support.
So the PPE is so I also have experience with PPE because so as a cardiologist, when somebody comes in with an MI and I take them to the cath lab and I'm operating on them, and since we don't do COVID testing prior to an MI, and emergency is an emergency, I'm not going to go there and wait. Do you get me a COVID test right now? I have to save a life. And so, I wear a PPE every day for my cases because every day I'm operating. And, when you wear the PPE, it's very difficult, right? I mean, so, I wear a mask, N95 mask. On top of that, I put my surgical mask. Then I put my lead glasses. And on top of that, I have the shield. And the shield keeps fogging up. And then my assistant takes it off, wipes it, puts the shield back on. And then, I touch my hand and I'm like, my hand got infected because the shield comes down to your chin. So it's a very challenging time. You have to do safety for everyone. But that being said, Dr. Samdani, we're all healthcare workers. We're all out there taking care of symptomatic or asymptomatic people. Like, few things, like when you go to a patient's room, like, do you always question yourself, am I nicely gowned up? If I don't, is this the patient from whom I'm going to get it? And then when you come home, you have a wife and a daughter, and then we all have parents. Like, are you like physically distancing yourself? Are you like, what is your protocol at home to make sure that to keep your family safe?
I have had a psychological impact. So when you go to a patient's room, obviously that fear is there. But when you're going to several patients, the fear only mounts. So I have had a good care at home. We have been away. My wife, my daughter have been away from me. We have kept a strict physical distance from each other. It's not easy, but I think that's the way we have to do it. My wife's a nephrologist. When she goes to work, she also needs to go to work. She also keeps a distance for at least 10 to 15 days from my daughter. So it's a difficult situation. It's not explainable. Only if you go through it do you understand the situation. And as you were saying, there are technical hazards, fogging, sweating, agony, mania, depression, anxiety, fear. You're fearful. Are you going to get it? Suddenly you get a sneeze. It runs in your mind. Have I got COVID? You can't smell something. I have to call my wife. I said, listen, I can't smell. Can you smell something? She said, it's clean air. I can't, I can't smell anything. So it's not easy. It's very, very difficult. Yes.
Absolutely. I mean, the other day, my brother was telling me that his friend, he went to the store And he said everybody for some reason was without the mask, or the mask was not positioned properly. And then suddenly he sneezed. And everybody put on their mask. And everybody got scared. They washed their hands. And and he was telling my brother this, and he told me, I said, oh God, and this is what happens. We see it all the time. The fear, I think the mental stress that everybody has with the sneeze, even during allergy season, for people who suffer from allergies, good Lord. The few of us some of us sneeze, and ask Sameer, I have my allergies at times. And
Sure, I know.
Sneezing
So I
is
think the clear message for people at this moment, I would like to tell them in a acronym, is don't touch men, or stay away from men, and always listen to women. So I won't say don't listen to men. That's easier. So don't touch your mouth, ears, and nose, and always listen to women. That means you keep a physical distance. You wash. So W is for washing your hands. O is for obeying commands or directives given by a local authorities and given by the government. M is for maintaining a physical distance, not a social distance. E is for eating healthy and exercising adequately. And N means be noteworthy of warning signs and symptoms that we spoke of. So don't touch men, always listen to women. If you can remember that, I think we'll win most of the battle of COVID.
I think that's an excellent closing note, Dr. Samdani. Yes. We're in the midst of a pandemic right now. It doesn't seem like it to many people, but these are tough times. We're in the midst of a pandemic. You don't get it very often. This is once in a lifetime thing. And I think it's important that we all stick together because, like I always say, this is the first time in the history of at least our lifetime, my lifetime, your lifetime, Sonia's lifetime, and most of us, that we're actually codependent on each other for our well-being. If you don't take care of it, I'm going to get infected. And if I don't take care of myself, you will get infected. And the same thing goes for house people, the teenagers who are going out. I saw somebody on Instagram posting pictures of a birthday party yesterday. I was shocked. I said, what are you guys doing, man? And they invited me and I said, you know what? I'm not exposing you guys to me. I'm scared. I'm not doing that for sure. But, just it's time to stick together and listen to what you have to say and use common sense. I think there's no judgment, common sense is priceless. So I think that's important that everybody try and use that. Anything else?
No, I think I just want to thank you so much. We've actually gone over an hour and we still have a lot of questions that people have asked. And, everyone, we promise you we'll get to it. We'll actually reply back to those questions. And, we'll have another session with Dr. Samdani. I think we have a lot more questions and COVID is here to stay. And I think so many things, we all can still learn from and we'll understand. And let's see what happens in the next couple of weeks.
Yeah.
How the numbers go, where we will be, where Delhi, where Bombay, where India, a country where we all will stand. And
I'm nervous. I'm nervous looking at the graph and with India opening and people wanting to go to mandirs and partying. It's making me nervous.
No, it's not an easy sign. It's not a good thing.
It's not a good thing. It always makes you wonder. As you said, livelihood and life, it's a
Jaan or Jahan.
Jaan or Jahan.
So, as we go into unlock one, I think it's what you've discussed, Dr. Gupta, Dr. Sonia, and Dr. Sameer is very, very important to keep ourselves safe, work, but keep a physical distance. And President Xi Jinping has just tweeted to me saying that no mingling still continues. So Xi Jinping says no mingling. Please stay away from each other, keep a physical distance, continue doing that. And as Dr. Sameer says, a pandemic comes typically once in 100 years. The last one came in 1920, one before that in 1820, one before that in 1720. I'm not predicting 3020, but probably this is the only pandemic and we are the fortunate or the unfortunate ones to have through it. Let's all sail, fight together and get over this.
Absolutely. Thank you.
And please like and subscribe to our page.
Subscribe. We'll
get a lot of information about COVID as we go forward, about other health illnesses. We'll keep you. We post out a lot of good information, so it'll be good for you.
Yeah, both of you are doing a superb job, and I keep seeing your blog, and I think a lot of awareness, personal experience. So keep up with the good work.
Thank you so
Thank
much.
you again.
Thanks again.
All right, guys.
Namaste is the way to greet.
Yes.
physically touch anyone.
Namaste. And thank you so much to everyone for watching. And please take care and stay safe. Bye-bye.
Thank you.